So, today we're going to talk about ending the stigma, busting the myths and misconceptions of mental health and mental health conditions. You see, recently I had one of the most important conversations with a loved one that I've ever had. And it was in that conversation that we began to talk about the stigma that surrounds mental health conditions. And I began to recognize the breadth at which the stigma pervades our society. And so, my hope is that by continuing to have these conversations and by continuing to bring awareness to the stigma, together we can begin to end it. And so, a little bit about me. I am a licensed naturopathic doctor, an acupuncturist, and mental health conditions run in my family. And since becoming aware of that at a fairly young age, I've been driven to gain a better understanding, both for the sake of my family and for my own mental well being. And so, a lot of what I do today is in the hopes and on the mission of helping people better understand themselves, better understand their minds, and better understand their bodies. And so, thank you for joining us and joining me as we talk more about the stigma that surrounds mental health and mental health conditions. So, what we'll be covering today is addressing the stigma in the room, gaining greater awareness and understanding, and the common myths and misconceptions. And so I just want you to take a moment to think, what comes to mind when you think of a person with cancer? Maybe the words strong or brave. And how about a person with a broken leg? Maybe we have feelings of compassion or empathy. And now I want you to think about what comes to mind when you think of a person with anxiety or a person with depression, a person with bipolar disorder, or what about a person with schizophrenia? Maybe you thought crazy, lazy, attention seeking, dangerous, weak. Maybe you've said, look at the bright side, or buck up, or it could be worse. Maybe you've said, just try harder, or just be positive to someone who's truly struggling. You see, our society and culture will support people with physical illness, but often not the people with mental illness. And this stigma around mental illness creates a barrier to treatment, to care, to preventative measures, and even to research and funding. It can cause a delay in seeking treatment that can be as long as 8 to 11 years from onset of symptoms. It can lead to social isolation, lack of understanding and being understood, fewer opportunities, bullying, harassment, and more. Breaking the stigma starts with increased awareness and gaining a better understanding. And it continues with compassion, honesty, challenging the current paradigm, and having tough conversations. So let's start with gaining awareness and understanding. So, what is mental health? The National Institute for Mental Health describes it as our emotional, psychological, and social well being. It affects how we think, feel, act, make choices, and relate to others. Mental health is more than the absence of mental illness, it's essential to your overall health and quality of life. And so, mental health is something that we all have. We all have mental health. And this is why it's important to bring awareness to mental health. And so, these are some of the factors that can impact our mental health: genetics, environments, our biology, social and political factors, psychological, behavioral, spiritual factors, and even economic factors. And so, what is mental illness? So, mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or maybe a combination of them. Mental illnesses are associated with distress and or problems functioning in social, work, or family activities. And so mental illness is often described as when it becomes a problem or it impedes on your daily activities. And so some of the risk factors, right? So we talked about the different factors that impact our mental health, but some of the risk factors, so having a family medical history of mental illness, genetics. So some studies have shown that having a father who is older than 45 years old at conception can impact the genetics and therefore potentially increase risk of mental health conditions later in that child's life. And then there's things that we just don't think about. So, our environment, having safety. If we are in an environment that is not safe to us, that can impact and increase our risk of developing a mental health condition. Often, what we look at is just the brain chemistry, right? We think about neurotransmitters, but we have to look at the whole picture because the whole picture looks at even our community. So, our social and political structures can impact and increase our risk of developing mental health conditions. Our economic stature, right? Our access to care, our access to education, all of these things can impact our and increase our risk of developing a mental health condition later in life. And so this just takes a look at how our risk factors can change throughout the course of our life. And a lot of it depends on who we're around, so our environment, our social structure, our community, um, all of that, right? How it shifts throughout our life. And so some of the mental health conditions include anxiety disorders, ADHD, bipolar disorder, borderline personality disorder, depression, dissociative disorders, eating disorders, obsessive compulsive disorder, post traumatic stress disorder, psychosis, schizoaffective disorder, schizophrenia, and substance use disorders. And so, just some of the signs and symptoms to be aware of are feeling sad and withdrawn for more than 2 weeks, confused thinking, difficulty concentrating, avoiding social activities, intense worries or fears, drastic changes in sleeping habits, eating habits, sex drive, personality, or mood, significant changes in weight, excessive use of alcohol or drugs, sudden shortness of breath, racing heart, overwhelming fear, seeing, hearing, or sensing things that don't exist in our objective reality, trying to harm or end one's life, or making plans to do so, difficulty carrying out daily activities, prolonged or strong feelings of anger or irritability, and denial. So these are just some of the signs and symptoms to be aware of when we're checking in on our friends and our community members and ourselves. So, more than half of people with mental illness don't receive help for their disorders. Often, people avoid or delay seeking treatment due to the concerns about being treated differently or fears of losing their jobs and their livelihood. So, this goes back to the stigma that can impede health or seeking treatment, right? Like I mentioned before, it can delay seeking treatment by 8 to 11 years. So there's three main types of stigma: internalized, social, and institutional. So we're going to start with the social because I really feel like this impacts each of the other areas, right? So we start with the stereotype, which is a negative belief about a group. For instance, people with mental health conditions are dangerous, they're incompetent, they have a character weakness. This can lead into a prejudice, which is an agreement with the belief or negative emotional reaction, such as, and then creates an emotional reaction such as anger or fear towards that group or those with mental health conditions. And then that can lead to discrimination, which is our behavior towards that prejudice. And this can look like avoidance, maybe withholding employment opportunities or housing opportunities, or not helping those with mental health conditions. And institutionalized stigma is obviously more systemic, and it can involve policies of government and private organizations that intentionally or unintentionally limit opportunities for people with mental illness. This can include lower funding for research or fewer mental health services relative to other healthcare. And then there's also the stigma, the internalized stigma, the stigma that we have about ourselves. And so again, we can internalize what the public, what our society has been telling us, that we're weak, that we're incompetent, that we're dangerous. And then this can create a negative emotional reaction, such as low self esteem. And then discrimination towards ourselves. So this might look like not pursuing certain jobs or opportunities because of this stigma that we have about ourselves. We don't feel like we're good enough or that we deserve this. Why try? What's the point of trying, right? So this can create discrimination against ourselves. And so it's time to break the stigma. So let's deconstruct some of these common myths. So, myth number one: mental illness does not affect me. Even if you don't have a mental health condition, someone you love or know likely does. More than 50% will be diagnosed with a mental illness or disorder at some point in time in their life. 1 in 5 adults in the United States will experience a mental health condition in a given year. And suicide is the second leading cause of death among people aged 10 to 34 in the US. The second leading cause of death. And so, all of this to say that, again, even if you don't feel as if mental health conditions affect you because you don't experience it personally, it is highly likely, just based on the numbers, that you know someone who does. And so it is still important for you to understand what that person may be experiencing so that you do not have a stigma against that person and you do not impact their opportunities to seek care. Myth number two: mental illness is caused by character flaws or personality weakness. it's all in your head, or why don't you just try harder, right? Mental health conditions are complex. Just like I mentioned earlier, there are many, many factors, and these do not include character flaws, right? There are so many things contributing to our mental health and therefore to our risks for developing a mental health disorder or condition later in our life. There is no one particular cause of mental health conditions. And this is why greater awareness and understanding publicly and institutionally is so important. The third myth is there's nothing that you can do for a mental health disorder. So why bother seeking help? There's a lot that we can do with supporting those with mental health conditions. And we continue to learn more and more options every day. And this is why I'm putting on this summit, Your Healthy Mind, so that you can begin to see what those options are and to gain a better understanding of your own mental health. And there's also things that we can do to prevent the onset. So there are protective factors, right? And these protective factors are also going to help those with mental health conditions by supporting them holistically, right? So this is why it's so necessary for us to all have a good understanding and awareness of mental health because it's not just one thing. And it really takes a whole community to be on board. And people with mental health conditions are dangerous and violent. Only 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. In fact, people with severe mental illnesses are over 10 times more likely to be victims of violent crime than the general population. And this just kind of makes my blood boil a little bit, right? Because of this stigma, we are impeding upon people's opportunity to receive care and thereby perpetuating the stigma, right? And they're the ones that are receiving the harassment, that are being bullied, that are the victims of these crimes. And lastly, suicide is selfish. Suicide is not chosen. It happens when pain exceeds resources for coping with pain. Rather than ask why the suicide, ask why the pain. And I linked this talk. This was a very profound talk in the resources that you'll see at the end here. And we're wrapping it up here, but the words and phrases that we use matters. We need to stop using these words in our day to day. You're crazy. That's retarded. I'm so OCD. I must be ADD or something. They're such a psycho. I'm so addicted to this TV show. That's so insane. Stop being so paranoid, right? These perpetuate the stigma and downplay the experience of those with actual mental health conditions. So we have to be mindful of the language that we use. And here are some examples. Instead of saying they're bipolar, schizophrenic, manic, the mentally ill, they committed suicide. Instead, let's try they're living with bipolar disorder, person with schizophrenia. We're putting the person first. Person with a mental health condition and died by suicide. Silence only perpetuates the stigma. So I'm asking you all to speak up, to talk to your loved ones about their mental health, to change your language, and to continue to educate yourself. Because together we can end the stigma. And here are some resources. I encourage you to watch some of these videos. If you or a loved one need help, please use these resources. And thank you so much for taking the time to increase your own awareness and to help end the stigma. Thank you.